everyone, today our topic is scapular attachments, ossification, and clinical anatomy. Okay, we have to understand the how to study the attachments. We have to divide them into origins, insertions, and ligaments so that we can understand properly. Here, red color represents the origins, blue color represents the insertions, and then green color represents the ligaments, and blue color represents the light blue color represents the articulation area, means facets. So coming to the origins, we have subscapularis, supraspinatus, infraspinatus, deltoid, long head of biceps brachii, coracobrachialis, long head of triceps brachii, teres major, latissimus dorsi, inferior belly of ohmoid. These are the origins. I will mark here. Short head of biceps and coracobrachialis, long head of biceps, inferior belly of ohmoid, long head of triceps, subscapularis, serratus anterior, and inferior belly of ohmoid, supraspinatus, infraspinatus, latissimus dorsi, and teres major, long head of triceps, and deltoid. These are the origins. How they are originated, I will tell. First, subscapularis. Subscapularis. It arises from the medial two-third of the subscapular fossa. It arises from the medial two-third of the subscapular fossa. Subscapular fossa I have already told you in the last videos, which is present in the anterior view, that is costal aspect of the scapula. Next, supraspinatus arises from the supraspinatus located in posterior view, dorsal aspect of the scapula, supraspinatus, and infraspinatus arises from the medial two-third of the supraspinous fossa, including the lower surface of the spine. Infraspinatus arises from the medial two-thirds of the infraspinous fossa, including the lower surface of the spine. I have told you it is present in the dorsal aspect, that is it divides the scapula into supraspinous fossa and infraspinous fossa, where that infraspinous fossa and supraspinous fossa gives rise to the infraspinatus and supraspinatus. Next, the deltoid. Deltoid arises from the lower border of the crest of the spine and from the lateral border of the acromion. The acromion fibers are multipennate. Multipennate means it has more heads. Trapezius arises from the lower crest. Lower crest means lower border of the crest of the spine. Means lower lip of the spine. Next, the long head of biceps brachii arises from the supraglenoid tubercle and the short head from the lateral part of the tip of the coracoid process. Long head and short head. This is short head and this long head. Coracobrachialis are here. Coracobrachialis over here. It is arises from the medial part of the tip of the coracoid process. It is the tip of the coracoid process. Long head of the triceps brachii arises from the infraglenoid tubercle. This is infraglenoid tubercle, that is long head of triceps. Teres major arises from the teres major. Here teres major, this is teres minor, arises from the lower one third of the rough strip of the dorsal aspect of the lateral border. Latissimus dorsi arises from the inferior angle. This is inferior angle, I have told you in the last video, that is arises from the inferior angle. Inferior belly of ohmoid is the last origin of the scapula. Here inferior belly of ohmoid is arised from the upper border near to the suprascapular notch. This is suprascapular notch. Next, insertions. Trapezius, serratus anterior, pectoralis minor, levator scapulae, rhomboid minor and rhomboid major are the insertions of the scapula. Where they are located? Here is upper lip of the spine, that is trapezius, and then serratus anterior is inserted along the medial border of the scapula. Here, that is blue color, serratus anterior is inserted over there in the costal surface. Pectoralis minor is inserted into the medial border of and superior surface of the coracoid process. The levator scapula is inserted along the dorsal aspect of the medial border from the superior angle up to the root of the spine. Levator scapulae. Here is the levator scapulae is inserted along the dorsal aspect of the medial border from the superior angle up to the root of the spine. The rhomboid major is inserted into the medial border dorsal aspects opposite the root of the spine. Rhomboidus minor opposite to the root of the spine. The rhomboid major is inserted into the medial border dorsal aspect between the root of the spine. This is between the root of the spine. Okay, insertions over. Next, ligaments. The margin of the glenoid cavity gives attachments to the capsule of the glenoid cavity gives attachment to the capsule of the shoulder joint and to the glenoid labrum. That are ligaments. The margin of the facet on the medial aspect of the acromion process gives attachment to the capsule of the acromioclavicular joint. The coracoacromial ligament is attached to the lateral border of the coracoid process and to the medial side of tip of the acromion process. Here is the ligament. Coracoclavicular ligament is attached to the lateral border of the coracoid process and to the medial side of the tip of the acromion process. The coracoclavicular ligament is attached to the coracoid process, the trapezoid part of the superior aspect of the conoid part near the root. The transverse ligament bridges across the suprascapular notch and converts it into a foramen which transmits the scapula nerve. The suprascapular vessels lie above the ligament. The sphenoglenoid ligament may bridge the sphenoglenoid notch. The suprascapular vessels and nerve pass deep into it. Coming to the ossification, the scapula ossifies from primary center and 7 secondary centers. The primary center appears near the glenoid cavity during the 8th week of development. Okay. Next, clinical anatomy. Paralysis of serratus anterior causes winging of the scapula. The medial border of the bone becomes unduly prominent and the arm cannot be abducted beyond 90 degrees. The scaphoid scapula is a developmental anomaly in which the medial border is concave. Thank you all. This is the thing from BD Chaurashya. We can easily understand by reading the BD Chaurashya book. Jai Hind.